The patient is already admitted. So we can start our introduction as, "Good morning. I'm Sarah, the head nurse working in this hospital. For my confirmation, can you please tell me your name?" Then the interlocutor may respond by saying, "Good morning, nurse. You can call me Jessica." We can respond to her saying, "Hi Jessica. I'm here to evaluate your current situation. How are you feeling today?" Then, she may tell you that I have extreme pain in my throat after the surgery. Then we can tell her that. "I am sorry to hear that. No need to be worried. You'll be alright. If you don't mind, can you please elaborate me in detail in order to understand your current condition much better?" Then she may respond to you that, "Nurse, I'm having some difficulties when I swallow something." Then we can tell her that, "Okay. I understand that you are going through a very difficult situation. Try not to be worried. As you know, you have undergone the thyroid gland removal surgery recently. So the pain is quite normal after the surgery. However, before proceeding further, may I ask you a few more questions to understand your situation much better?" Then she may agree with you. Then ask her, "Did you have breakfast? What do you feel when you eat something?" Then she may tell you that I feel extreme pain while I swallow something. Then we need to understand the intensity of the pain. So respond to her saying, "Can you please rate your pain on a pain scale where 0 is the least pain and 10 is the worst pain?" Then she may tell you that it's almost 9. "I can't even swallow anything." Then respond to her saying, "I understand. It is very difficult to cope up with this situation, but try not to be worried. It will subside within a couple of days if you follow the antibiotics and other medications on time, which were prescribed by the doctor. Normally this pain happens because of the surgical wounds and swelling existing in your throat. Are you following me? And do you have any questions?" She may respond by saying, "Yes. Nurse, I have another concern." Then she may tell you that, "I cannot even speak properly. What should I do? It gives me throbbing pain and it irritates me as well." Then tell her that I understand your worries as I told you before. The pain is common among patients who have undergone thyroid gland removal surgery. There is nothing to be alarmed about. It will be resolved after taking a set of antibiotics. However, I would like to give some more instructions to manage these conditions. Is that okay for you? She may respond, "You. Yes. First of all, please do not take any solid foods for a few days and instead, you can take some softer or liquid foods so that it will not irritate your throat much. Are you following me?" Then she may agree with you. You can ask her if she has more questions. Then she may tell you that, "Well, I'm having difficulty when I breathe. I'm really unhappy due to this situation. May I know the reason for the uneasy breathing pattern?" Then reply her, "Please do not get upset with your current situation. These breathing difficulties are also quite normal for all the patients after thyroid gland removal surgery. There is nothing to be alarmed about anyway. I can discuss it with your consulting doctor for more clarification regarding these symptoms." Then the interlocutor may thank you for that. And she may ask you one question, like, "Well, thank you. I'm unable to bear these troubles for my clarification. May I know how long these will last?" Then reply to her by saying, "I certainly acknowledge your worries. I assure you that this pain and breathing trouble will fade away completely in 2 to 3 weeks and you will be perfectly. Are you following me?" Then she may ask you, "Nurse, will there be any effect or a change in my voice in the future?" Then reply to her, "There will be a slight change in your voice, as this operation was one of the complex ones. However, I suggest you do not worry as there won't be any sort of problem for you in the future. Also, tell her that apart from that, please do not pressurize your vocal cord too much by speaking continuously. Instead, you can use a pen or paper to convey your ideas. Also, try to elevate your head, always with a pillow even when you sleep, so that it will give you a better relief from the pain." Then ask her if she has any more questions. If no, wind up the sessions by saying, "So far, we have been discussing your current condition and its management. If you have any more concerns, please ring the buzzer, which is near to your bed. I will be here to assist you. Once again, I assure you that if you follow the medications and instructions properly, definitely you will be able to lead a normal life as before." Then she may thank you for that. Then thank her again by saying, "Thank you for listening to me patiently. I wish you a speedy